Join Marty Johnson, the holistic health practitioner and founder of Total Health Nutrition Center in Menominee Falls, Wisconsin, as he delivers these podcasts to enlighten you and give you hope that there are health solutions to conditions that seem difficult to resolve, or even better answers than a medical approach of prescribing a chemical drug, which most times is nothing more than a Band-Aid fix, rather than getting to the root cause of your problem. The mission of the Total Health podcast is to provide the education and support that will lead to transforming people's healths so they can live a much more efficient, productive, and happier life the way God intended it to be. Join him now for his latest podcast.
Okay, I'd like to be able to talk to you today about cholesterol and some of the concerns with looking at cholesterol from a standpoint of the blood work and what are some of the real risk factors that you want to be looking at. Oftentimes, we're told that if you just have a general cholesterol level, total cholesterol level over a certain amount, that's bad, and we should immediately be thinking about medications. And I don't want to tell you or sound like we should be ignoring these things, but basically the point in this podcast is to help you see that there's much more in-depth things to look at in consideration of what really are risk factors and what are not as much of a risk factor. So with that being said, I'd like to be able to start out by talking about just the typical markers that we would be looking at or that the medical system looks at for cholesterol. First one would be LDL cholesterol. So LDL cholesterol is basically the function of LDL cholesterol is to deliver cholesterol to the cells. So that's where it is used for the cellular membranes or for synthesizing your steroid hormones. So really, most of your hormones from a very base material level starts out with cholesterol. So that tells you right there that LDL cholesterol is considered or kind of given this name as the bad cholesterol. But the question I would have for you, is it really bad if every cell in your body needs it, because your cell membranes that actually house everything going on in your cells is made up of cholesterol, and you need cholesterol to manufacture hormones. The other thing that's actually made up of the cholesterol is the myelin around your nerves. So just like a wire has an insulative coating on it, your nerves have this insulative coating called myelin, which is actually made up of cholesterol. So you can imagine that your brain has one big mass of nerves, which your brain is made up of. So your brain has a lot of cholesterol. So it is an important substance to have in your body, and therefore important that we don't drive that level down too dramatically, especially with medications. Matter of fact, there's studies showing that lowering cholesterol or cholesterol medications, when we lower your cholesterol too much, actually is linked to part of the cause of dementia, because you need cholesterol for brain function. Another common marker is HDL cholesterol, and HDL cholesterol actually helps you transport cholesterol from the cells and tissues back to the liver so that your body can process it out through the digestive system and out through the stool. So really, cholesterol, the HDL takes cholesterol out of the cells and the blood and helps to prevent excess cholesterol buildup. So that's really kind of what it does in a summary overall. But it removes cholesterol from that's cholesterol that's deposited in the walls of the blood vessels as well. So HDL, you can kind of think of it as sort of a mop that's cleaning up any deposited cholesterol that might be in the blood vessel walls or artery walls. So that's the role of HDL. The other common marker is triglycerides, which you might hear on just a general blood test. And triglycerides are actually a fat that's in the blood, that's in your blood. And if these levels or triglyceride levels are elevated, it's often associated with higher sugar diets or higher glucose. So maybe even people with potentially, we call it insulin resistance or type 2 diabetes, oftentimes have higher triglycerides. So what I would like to mention is this is commonly where most medical tests for general screening and so forth, this is where it ends with these major markers that I just mentioned. What I'd like to talk about a little bit, and then once I get through talking about some other markers that should be considered, we'll talk about some of the really true factors that would create more risk for heart disease and arterial buildup as we go along. And then I'd like to share with you some of the dietary considerations or supplementations that we would be looking at in a clinical setting when we work with people in our clinic. So there's a whole other realm of testing that really looks deeper at your true risk factors when it comes to cholesterol. There's a blood panel that we often will recommend people to get or will have them do. It's called an NMR, Advanced Lipid Profile, NMR. So this particular profile is looking much deeper at what's going on with cholesterol, meaning that it's actually looking at LDL, but what's called small LDL. So LDL, low-density lipoproteins, there's different lipoprotein particles that are floating around, and whether those particles are small or large is going to be a big factor in what your risk factors are for maybe arterial buildup and so forth. So small LDL is considered, if you have higher numbers of small LDL, your risk factors are much higher. So actually many recent studies have looked into the importance of LDL particle size, and studies are showing that people whose LDL particle size are predominantly small and dense have a 3-fold greater risk of coronary heart disease. Now, on the flip side, the large LDL particle sizes, the study goes on to say that the large and fluffy type of LDL may be more protective. So what I'm really getting at here is you could have a normal cholesterol profile where they're just looking at LDL and total cholesterol and HDL, and it may actually look good, but if you have more predominantly smaller particle sizes of that LDL, even though your normal profile may look okay, your risk factors are still high. So it's very valuable to know that. On the flip side, just like I said, you might have higher, you could have a higher cholesterol level when we're looking at just the general total cholesterol, LDL, HDL. But if you have more predominant large LDL particle sizes within that reading, your risk factors actually still may be lowered, even though it looks like they're higher from the other simple end of things. So I hope that made sense, but it's a real important aspect to look at. Another aspect in this advanced lipid profile is looking at what's called oxidized cholesterol. So oxidative cholesterol is looking at, is the cholesterol itself in the artery walls more likely to oxidize, which is a chemical reaction that would make it typically tend to be more sticky and attached to the artery walls more. And that begs to look at further aspects of as to why that would be oxidizing. Is it diet? Is it a lack of certain nutrients in the diet, which we'll talk about. The other couple of markers that I'll mention quickly is, one that you don't hear a lot of is called homocysteine. And homocysteine is a common amino acid in your bloodstream, and high levels are really linked to early development of heart disease. So homocysteine levels that are elevated are actually associated with low levels of vitamin B6, B12, and folic acid. So it's one of those things where it's valuable to know where those levels are at, because if you do know, it's a pretty simple fix. But otherwise, you're just kind of shooting in the dark. And then the last major marker that I would like to talk about is called CRP, and that stands for C-reactive protein. Now, a marker indicating, so a CRP really is a marker that's indicating that there's an inflammation process going on in your body, okay? And inflammation, believe it or not, folks, is really your major thing you want to look at when it comes to risk factors. So what do I mean by that? Well, if you have what we call systemic inflammation, that means that there could be inflammation going on all the way down to your cellular walls, the cellular membranes, inflammation going on in the arterial walls that you're totally unaware of. You may not have inflammation that you're aware of at all in your joints, or what we would normally think of inflammation causing problems and like achiness and things like that. But you could still have a whole lot of inflammation going on a deeper level in your artery walls and in your cells and things like that. So when this inflammation is going on, especially like in the artery walls, what can happen is that inflammatory process can start to damage the inner lining of your blood vessels and arteries. Now, that inner lining of the blood vessels and arteries are actually a very smooth lining, about 1 cell thick, that allows the platelets for your blood and things like that and cholesterol to kind of slide through very smoothly and easily. But if there's an inflammation process going on, that lining can develop little holes in it that or basically damage, and your body's going to do what it's designed to do. It's going to go in and patch that damage up before it becomes a big problem. And what it's actually using as a substance to patch that up is the LDL cholesterol. So it's going in and patching it up, kind of like if you have a little, if you skin your arm or elbow or knee, you start to develop a scab on that, and it's kind of like a patch over that injury. Well, that's sort of what your body's trying to do in the artery, on the artery wall. And in a normal situation, basically what should happen is the LDL cholesterol should come along, or the HDL cholesterol will come along and then clean that patch up so that it's not building up too much. But the problem is that if you have this systemic inflammation going on over time, there's continuous holes being developed. When we say holes, we're just talking about damage to that inner lining of the artery wall, and the body's going to continue to keep patching that up, and the HDL cholesterol is not going to keep up with that. And now we start to develop what's called atherosclerosis, which is a buildup in that artery, which basically can eventually create a blockage. A lot of times you'll hear people that have started getting weaker or notice that their energy is going down and their breathing is more labored, and they go in and have a scan and find out that they have an 80% blocked artery or what have you, and then they have to go through a procedure where they put a stent in, which is basically a device that opens that artery back up for where it built up that plaque. The problem with that is that you're not really solving the underlying issue, which was the inflammation to start with. So this inflammatory process is critical, and your risk factors are way higher. What we also know is that a person that has very low inflammation in their body could actually have higher elevated cholesterol levels and still be at a very low risk, because if the cholesterol is elevated but the inflammation is low, it's not going to be building up in the artery walls as easily. Okay. Of course, I'm not suggesting that you just let your cholesterol go wild just because your inflammation is low, but we still want to not overreact and just say, oh, cholesterol is high, so therefore I'm going to jump on this medication. We want to look at all of these factors and consider them very carefully before we just go on a medication that could cause more damage to other organs and things like that. So low inflammation or the inflammatory factor is a big factor. So what do we do in a clinical setting? Once we look at some of these factors and we know they exist, what are some of the ways that we work with people to start to improve this whole process and improve the cholesterol? Well, the first thing is that this is going to be kind of an obvious statement, but we would look at switching this person to what we would call a very low IF diet or low inflammatory diet. The first and foremost would be we would start to lower their sugar and complex carbohydrate, starchy carbohydrate levels in their body. Usually when we do that, that starts to drop their triglycerides down pretty quickly. And these processed sugars and carbohydrates cause a lot of inflammation in the body. So by lowering that and putting a person on what they would call maybe a paleo diet or maybe even a ketogenic diet, which means that we would be dropping carbohydrates really low so the body is burning more fat as their energy source versus the sugars and carbohydrates. The other factor is that we would want to start to eliminate bad fats out of the diet. So what are bad fats? Well, one really good example of a bad fat would be hydrogenated oils or trans fatty acids. And that basically what that is taking for instance, taking a corn oil and converting it into a solid. Back in the 70s, they started doing that, and they call that margarine. Problem is that nowadays, a lot of people are learning that margarine isn't very healthy, so they're going back to just the real butter, which is actually much healthier, and thinking that, well, okay, I'm good to go. I made that switch. But the problem is that the food industry is putting a lot of these hydrogenated fats, and they're burying it in a lot of different products because it's very cheap, and it gives the food a good texture and so forth. So we have to really do a lot of educating and teaching people on what to be looking for. And of course, once we get those bad fats out, we want to replace them with good healthy fats, which can help on all levels of cholesterol, including even elevating or reducing that small LDL cholesterol, which we said was very dangerous. So first of all, fish oils, even in the diet, eating healthy, levels of fish, from wild-caught salmon to sardines, things like that, is very healthy. Olive oil that's non-rancid, so it's important to be looking for good quality oils that are not rancid. Avocados are a great source of fat, things of that nature. Even coconut oil that's processed or not processed, basically it would be raw, virgin, organic coconut oil, can be very healthy to help with the good cholesterol, okay? So those are just a few examples in the podcast to just kind of give you an idea of making shifts in the diet for cholesterol reasons. From a supplemental standpoint, many of you have heard of fish oil being beneficial, although we could do an entire podcast just on fish oil. It's very, very important to be getting high quality fish oils, which is very hard to even know nowadays. Because fish oils can be rancid in the soft gel just through the processing process in the manufacturing plants. There's very few really, really good fish oil products. In fact, some of the better ones, or the best ones that I've found for cholesterol are fish products. They're in a tablet form, but they're not an oil. They're actually an extract, concentrated, extruded extract of fish that comes from the head of the salmon. And this has other properties that fish oil won't. more phospholipids and peptides that have a better effect in the liver to lower cholesterol and actually have effects on improving brain function as well on a different level than what fish oil could. Other things that are important, remember we talked about oxidized cholesterol and how dangerous that can be. So logically we would, taking nutrients or maybe even supplementing antioxidants that are basically, reducing oxidation in the body. A really good one that a lot of times we will use in combination with other products is called resveratrol or OPC extract from grapeseed extract. Now, with just like fish oil, it's important to be using quality products. Many products that are called OPC or, grapeseed extract can actually, state a milligram, but it might have 100 milligrams of OPC, but maybe it might say 100 milligrams of grapeseed extract, but it might only have 30 milligrams of the OPC, which is the active component. And it's really, really hard from the labeling to know if you're getting a true 100% OPC product. What we've found is there's certain companies that have developed exclusive processes out of France that it's a very delicate process to process the grape seeds to get a maximum amount of these OPCs out of the grape seeds themselves. So a lot of things to consider. Also, quality vitamins, synthetic vitamins that have isolated fractionated B vitamins in them or nutrients in them are not really that good at all, because when you take in a vitamin that is not in its whole food form, you're missing certain elements and enzymes and cofactors that would have normally been in that food. If you're taking a fractionated, isolated, B complex, for instance, your body's not going to recognize it as real food, so it's going to rob those other nutrients out of it to figure out how to metabolize it, actually causing other deficiencies. So if we have a whole food nutrient, in a pill form, your body's going to view it as real food and utilize all of it. And those are all, really important. Vitamin C in a whole food form, certain whole food multivitamins are all good, when we talk about balancing a person's body chemistry and helping them with the cholesterol. And the last thing that I would mention is a very unique product that has a substance called mezzo glycan in it. Not to get too technical, but in the easiest way that I can think of describing it is mezzo glycan does for your arteries just like glucosamine does for your cartilage in your joints. So glucosamine gives you the raw material to build up the cartilage in your joints, because as you go through life, you're going to wear cartilage down. And if you don't have enough raw material from your diet, you're actually going to wear cartilage quicker than you're building it up. So glucosamine, some of you might know that product because it's more common, will actually give you raw material to build that cartilage up. So I say that to say that mesoglycan is that kind of substance for your artery walls. So mesoglycan can go in and more rapidly heal that lining of the artery walls, just like glucosamine's helping to build up the cartilage. Mesoglycan goes in and heals and builds up that artery wall, which can reduce the damage that might have been done already, which is a phenomenal thing. Really, really good. Matter of fact, I've worked in this field for 25 years, 27 years, and some of my clients actually were clients of Dr. Davis, who wrote the book Wheat Belly. He was a cardiovascular surgeon, or a cardiovascular doctor, I'm sorry. And so some of my clients were mutual clients with Dr. Davis. And when I started to introduce this mesoglycan to my patients, and they would tell Dr. Davis what I was giving them, he was just dumbfounded because he's like, man, I've been looking for a substance like this for years and haven't been able to find it in a supplement form. So he knew right away the benefits of this substance for people that had damaged artery walls and so forth, and how it can help to heal. So very cool stuff. Thought I would just give you a taste of some of the things that we do in our clinic and things that we can work with to help people with some of these difficult situations. Hope you enjoyed the podcast. Have a great evening.
Thanks for joining us today on the Total Health Podcast. If you'd like more information about how Total Health can transform your health, check them out. They would love to set up a free consultation with you over the phone. Call them at 262-251-2929 to make that appointment. Otherwise, you can check them out on the web at www.totalhealthinc.com.